On behalf of the European Society of Endocrinology and the French Endocrine Society, we have the pleasure of being in the presence of Dr. Ronald Kahn. Dr. Kahn is the president of the Joslin Clinic, the chief academic officer of that institution, one of the most prestigious institutions in the world. So he has given this morning a wonderful lecture dedicated to the pathophysiology of insulin resistance and diabetes. And that lecture was part of the Ipsen Foundation Prize that he has received this morning. So Dr. Kahn, I would like to ask you a few questions concerning your work. The first question concerns the relative role of genetics and environment in the pathophysiology of type 2 diabetes.
This is really a very tough question to start off with. We really know that both environment and genetics play a role. I would say that what is evolving over the last several years is, of course, that as we do more and more genetic studies, it becomes clear that there may be many genes with a very small influence. And that really probably also we are underestimating the role of the environment. I think that many things that we think of as being potentially genetic are really shared environmental factors. So when we look at familial coincidences of diabetes, we now have to not only take into account that these are related people, but they're also sharing a same environment. This morning, as you know, I spoke about the gut microbiome, and we know that among the things that people have who share similar environments is they have more similarity in their gut microbiota, which is really an environmental factor, but can mimic in some ways genetics. So I think over the next several years, we're going to probably rethink the role of genetics and environment. It will certainly be a balance, but I think environment's going to take more important roles looking forward to the future.
So you have suggested that obesity is the key factor for insulin resistance, and that is under the control of the microbiome and the environment somehow. Maybe not only, but this is one of the key factors using your different strains of mice. Can you comment on this?
So obesity is certainly, of course, the biggest driver of insulin resistance that is acquired. And obesity itself is really a combination itself of genes and environment. And the microbiota in our gut, our intestinal microbiome, definitely plays a role in both food absorption, but also in inflammation, bile acid metabolism. And we know that these factors like inflammation and bile acid metabolism affect insulin sensitivity. So I think that what we're seeing is new ways that we can integrate the signal of diet with obesity and insulin resistance that we have to also take into account as we look at the pathophysiology of type 2 diabetes.
So using different lines of mouse with different microbiome constitution, you showed clearly the relationship between the constitution of the bacteria of the gut and obesity and the risk of diabetes. You all also shown science fiction data suggesting that treatment with antibiotic or antiseptic could influence the composition of the microbiome. Do you think there is a possibility that this will be of interest in the treatment of diabetes?
I believe that there are many ways we could influence the microbiome. I think that what we do for experiments, of course, are very dramatic things. We use antibiotics, which are very potent and have very broad effects. I think ultimately, if we can understand which microbiota, which bacteria in the intestine are positive for our metabolism and which are negative, what I think eventually we would like to think about is a more designer probiotic, something that gives you the right balance of microbes that are the most beneficial and not to have to use something like antibiotics, which I think can have effects, but of course have also many long-term side effects if you do them chronically.
There are some fascinating data following bariatric surgery in type 2 diabetes in obese patients, where they normalize their glycemia very fast following surgery. Do you think it's mediated through other mechanisms again, in addition to the microbiota? And
yes. So bariatric surgery certainly has very dramatic effects. There are really several components, almost certainly, to these effects. In the acute phase, of course, there's a lot of acute food restriction. And in fact, several studies have shown that if you do the same level of acute food restriction as the immediate post-op patient, a lot of this rapid improvement is really due to the very marked food restriction. But then chronically, we know that there are important beneficial effects not only on weight loss, but on insulin secretion and insulin sensitivity. Some of these will likely be mediated by changes in the gut microbiome. Some will be mediated also by changes in intestinal hormones. And I think that we are only really now beginning to dissect some of the different intestinal hormone roles. We know of about 30 intestinal hormones that could change, but now there are many new researcher projects looking at new hormones that might be modified, new peptides from the intestine that might be discovered through the use of bariatric surgery, which might be a way to mimic some of the beneficial effects even without the surgery.
So this line of research, I'm talking about the microbiota, since it is influencing inflammation as well, is likely to be useful for many, many diseases in addition to diabetes.
Mm-hmm. The full role of the gut microbiome is really still to be discovered. Clearly the most important direct role we know is in intestinal diseases, and intestinal diseases where there is an abnormal balance of bacteria. Of course, clinically the most well-known example is Clostridium difficile infection, which can cause severe diarrhea. But there's also a lot of interest in inflammatory bowel disease, like ulcerative colitis and Crohn's disease, that could be influenced. Metabolic diseases, not only diabetes, but fatty liver, obesity, and other metabolic diseases may be influenced. And now there's a lot of research being done looking at many autoimmune diseases as well, where we know that the environmental triggers may actually be things that are entering through the intestinal tract.
Dr. Kahn, we thank you so very much and we congratulate you for your work. It is very exciting and we'll be in touch following your research. Thank you very much.
Thank you very much. It was a pleasure.